If you have an L3-L4 disc bulge, you've probably already noticed that almost every video on YouTube about disc bulges and herniations is focused on L4, L5, or L5S1. Everything is about sciatica, glute pain, and symptoms running down the back of the leg. But your pain feels different. Your pain stays in the front of the thigh, your quad feels weak or unreliable on stairs, and sitting too long triggers burning or numbness that never matches the typical behind the leg pain pattern. That's because L3-L4 does not behave like the lower lumbar disc problems, and following that advice may actually be making things worse. So today this video is dedicated entirely to L3-L4 disc bulge, why it behaves differently, what is actually happening at this level, and everything you need to know to finally make sense of your symptoms. Be sure to watch until the end because I am also going to walk you through 5 exercises specifically targeting the L3-L4 disc area that may help relieve that front thigh pain, reduce irritation around the disc and nerve, and improve strength and stability through the lower back and leg. I'm also going to explain an overlooked neurological connection between the L3 region and the urinary bladder and share a remarkable patient story of a woman whose bladder pain syndrome dramatically improved after addressing this exact level, even after medications had already failed. Let's dive in. I'm Dr. Cordova, a chiropractor here in Houston, Texas. What makes L3-L4 so confusing clinically is that many patients start chasing the wrong area entirely. They spend months focused on the glutes, piriformis, or hamstring, because that is what most of the disc bulge videos tell them to do. Meanwhile, the actual irritation is happening higher up in the lumbar spine, and the symptom pattern keeps getting overlooked. The L3-L4 level also tends to create a very different type of feeling through the leg. Instead of feeling like the leg is pulling or tightening down the backside, people often describe a heavy sensation through the front of the leg. The knee may feel unreliable getting out of a chair or climbing stairs. Some patients even change the way they walk without realizing it because the quad is no longer firing normally. To understand why these symptoms feel so different, it helps to understand what is physically happening at the L3-L4 level. Between each vertebrae sits a spinal disc that acts like a shock absorber. When that disc starts bulging or herniating, it can create pressure and inflammation around nearby nerve roots exiting the spine. At L3-L4, that irritation commonly affects the L3 or L4 nerve root region, which changes the entire symptom presentation compared to lower lumbar disc bulges. Instead of sending pain primarily into the buttock, outer leg, or calf, or foot like classic sciatica symptoms, this area often refers pain into the front of the thigh, the knee region, groin, or sometimes even the inner leg. That is because this level is much more connected to the femoral nerve pattern than the sciatica nerve pattern most people are familiar with. The femoral nerve helps control the quadriceps muscle and sensation through the front of the thigh and inner leg. This is why patients with L3-L4 disc bulges often describe weakness in the thighs, numbness or tingling in the front of the thigh, or difficulty with stair climbing instead of the classic sciatica presentation they were expecting. What also makes this level tricky is that inflammation around the nerve does not always create sharp pain immediately. Sometimes it shows up first as weakness, instability, burning, altered sensation, or deep aching feeling that people cannot fully explain. That is why many patients spend months chasing muscle tightness when the real issue is nerve irritation and disc inflammation occurring at the L3-L4 level. Once that irritation continues long enough, the surrounding muscles start compensating. The hip flexors tighten, the posture changes, movement patterns shift, and the body starts trying to protect the area. That compensation pattern is exactly why so many people end up doing exercises that continue aggravating the disc and nerve instead of helping calm the irritation down. Now that you understand why the L3-L4 disc behaves differently, let's go through 5 exercises specifically targeting this area. The goal here is not aggressive stretching or random sciatica routines. These movements are designed to help reduce irritation around the L3-L4 disc and nearby nerves, improve mobility through the lumbar spine and hips, and restore strength and stability through the leg, especially the quadriceps. Starting with the supine knees-to-chest stretch. This exercise is designed to gently open up the lumbar spine and reduce tension around the irritated nerve root. Many people with L3-L4 irritation feel relief in slightly flexed positions, which is why this can be a good starting point before moving into strengthening work. Okay, this is supine knees to chest. All we're trying to do is get that low back to flex and create some space. So you can do this one at a time. You want to just hold it for a nice good 10 count. You can do the other side. But I think most importantly for this one, we want to do both knees at the same time because we're trying to create that opening in that lower back. So you're just going to pull both knees up to your chest. I also find it reasonably comfortable to kind of rock back and forth a little bit and try to create some space. Little pulsing, pull, pull, pull. You want to just feel like everything's opening up. Hold this for a good 10 count. You can hold it longer. I would do 3 sets of this as well. Exercise number 2 is the hip flexor lunge stretch. As the body compensates for irritation at L3, L4, the hip flexors often become extremely tight and overactive. This stretch helps improve mobility through the front of the hip and may reduce some of the pulling and compression feeding into the lower back. Okay, so this is the hip flexor lunge stretch. So we're going to be targeting this one right here. You don't want to have your foot too close in here because then you're really just stretching your calf. So you want to have a nice 90-degree angle here to do that. We don't want to be leaning too far back. You don't want to be bending forward and losing all the stretching here. You want to stay as neutral as you can. And you should feel it all right through here in the front, above the thigh, right where your hip meets your pelvis. And we're just going to lean in and pull back. It's also very comfortable sometimes to put a pillow underneath this knee. So if you're having any kind of knee issues, that would be comfortable as well. We just want to hold this stretch. So you can do pulsing, but really a long hold of about 30 seconds into the stretch would be preferable. The longer you can hold it, the better. We're just trying to get a good stretch in there. It's important that you're not overstretching. So meaning when you feel it stretch, that's good enough. You don't need to try to dig and try to get a good stretch in there, especially if it's painful. Good 30-second stretch. Switch sides, do it again. Exercise number 3 is the straight leg raise. One of the biggest problems with L3, L4 irritation is weakness through the quadriceps muscle. This exercise helps activate and strengthen the front of the leg without placing excessive stress on the spine. Okay, so with straight leg raisers, we're gonna use this as our affected leg. So we're gonna assume that the right leg is the one we're having trouble with. You can do both legs, of course. But if this is the one you're getting weaknesses, we're gonna lay on our back. We're gonna tighten the quad muscle on this side here. Lift your foot up just a little bit to make sure that quad is fully engaged. And then you're just gonna lift it up and bring it back down again. Lift it up, bring it back down. Nice and slow, nice and easy. All right, then you can stop. You're gonna wanna do 3 sets of 10, and I would do this every single day. Exercise number 4 is seated wall sits. Once the quad starts activating better, this movement helps build more endurance and stability through the leg. This is especially important for people who feel weakness, instability, or fatigue during standing or stair climbing. All right, so we're gonna do the wall sit. And so all we're trying to do is build quad strength. This is perfect for building up stability. The key here is that you really wanna get to about 90 degrees. So this is not a wall sit, and you don't have to go into a full squat. We just wanna stay to about 90 degrees, just like you're sitting in a chair, but there is no chair. You're definitely gonna feel it here pretty quick. You can play around with lifting up your calves a little bit and giving yourself a little more space, but really we're just trying to hang out here. You'll feel the burn pretty quickly in here, and all we're trying to do is build up some stability. So I would say hold this as long as you can. So if this is 15 seconds and 10 seconds and you're dying, then just build it up. We really want to get to 30 seconds to a minute. Really, if you're doing a minute, you're doing great. You can hold it longer, but there's no reason to do that. So once you find yourself that it's burning, push through, push through, push through. Try to give yourself a little more endurance to build that up, and then you're all set. And that's your seated wall sit. Exercise number 5 is one of my favorite movements for targeting the L3, L4 area more directly. Standing lumbar extensions are commonly recommended for lower lumbar disc bulges like L4, L5, and L5-S1, but you rarely hear people explain how to specifically target the L3, L4 level by itself. By using your thumbs as the fulcrum point directly at the L3, L4 region during the extension movement, you can focus the motion much more precisely at that segment instead of driving all the pressure lower into the spine. For some patients, this helps create significant relief by reducing pressure and stiffness directly at the L3, L4 disc bulge, especially after prolonged sitting or bending throughout the day. Okay, so this is your standing extension. Now the difference is if I were to just extend, I'm not isolating any particular part. So what I'm gonna try to do is use my thumbs to dig in there. Now if we feel right at your belt line, that's L5. You wanna move up a little bit more, maybe 2 more inches to where you feel like you're right on the spot that may be a little bit tender. And that's what we're going to use as the fulcrum point to lean back into that spot. All we're trying to do is open up that space. You don't have to go back extremely far. You're just trying to open up some space there. Keep your thumbs right at that spot the whole time. You might have to play around with placement until you feel like you're exactly opening up that spot to make sure you're on the right vertebrae. Give yourself a little rest, 3 sets of 10, and call it a day. One of the most overlooked parts of the L3 region is that this area is not only connected to the muscles and sensation of the leg. There are also important neurological relationships involving the pelvis and bladder that many patients never told you about. Now, that does not mean that every bladder symptom automatically comes from an L3-L4 disc bulge, but clinically, there are cases where irritation and dysfunction in this region appear connected to symptoms people would never immediately associate with the lumbar spine. That is part of what makes this level so confusing. Some patients spend years chasing hip problems, knee problems, pelvic problems, or bladder issues without anyone ever stepping back and looking at what may be happening higher up in the lumbar spine. I once had a patient who came in dealing with interstitial cystitis, also known as bladder pain syndrome. She had already gone through strong medications and was reaching the point where surgery was becoming part of the conversation. In fact, she was contemplating the possibility of living without a bladder because nothing she had tried was giving any kind of lasting relief. When we evaluated her, one of the major findings showed up around the L3 region. The dysfunction was visible on imaging and was also matched the symptom presentations we were seeing clinically. At that point, our goal was simply to see if reducing irritation and improving function through that area could help provide some level of relief. After a few visits, she described a feeling of like a cooling sensation traveling down through her legs, followed by a major reduction in her bladder pain symptoms. That improvement continued over time, and now more than 10 years later, she is still doing well and never needed the surgery she once thought was inevitable. Again, this does not mean every bladder condition comes from the lumbar spine or the chiropractic treatment for bladder problems, but it does show how important it is not to overlook the neurological relationships connected to this region, especially when symptoms are not responding the way they should. My goal with this video was to give you a better understanding of how an L3-L4 disc bulge actually behaves, because this level is often very different from the lower lumbar disc problems most people hear about online. You also now have 5 exercises that may help reduce irritation around the disc and nerve, improve mobility, and restore strength and stability through the lower back and leg. And just as importantly, you learn about the overlooked neurological connection between the L3 region and the bladder, and why some symptoms connected to this area may not always look like typical disc problems at first. If you can relate to anything we talked about in this video, drop a comment, let me know what symptoms you have been experiencing with your L3-L4 disc bulge. I read every comment, especially because so many people dealing with this level feel like their symptoms never match the information they find online. Also, make sure to like and share this video so other people struggling with an L3-L4 disc bulge can finally get the information that actually matches what they're going through. Remember to subscribe if you want to learn how to take care of your spine, prevent flare-ups before they start, and stay active and pain-free with clear, practical, actionable strategies you can begin using right away. And if you're trying to figure out how to sleep more comfortably with an L3-L4 disc bulge, reduce nighttime irritation, and stop waking up with increased pain and stiffness, go watch this video next.